Today we're going to start out with the male reproductive system. Start off by identifying all of the parts and functions. Function of the male reproductive system is twofold. One is to produce sperm and deliver sperm for reproduction. The other is to produce androgens. An androgen means a male generator. And so testosterone, dihydrotestosterone, those are your steroids or your androgens, and those are produced by the testes as well. The external genitalia, the penis, the testes, which are contained within the scrotum. Also within the scrotum is the very first part of the vas deferens, which is the delivery tube that's going to go up and around and deliver the sperm. Internally, you have most of the vas deferens. You have seminal vesicles, which are going to add some fluid to the sperm as it moves through. It's going to move through the prostate gland, which adds some more fluid. And then it dumps into the urethra, where it shares the tube with urine. Here we have it. Here's the rectum and anus back here. Here we have the penis. The head of the penis is called the glans. We'll see that. The prepuce is the foreskin, which is removed during circumcision. You have the testicle or testis, which is filled with seminiferous tubules that actually make the sperm, create the sperm to begin with. It's stored in the epididymis until it's needed. It's delivered through the vas deferens, goes through the middle of the, or right past the seminal vesicle where it dumps some extra fluid in, goes right through the prostate gland, which again adds more fluid, and then empties into the urethra shortly after it empties out of the bladder. There's a valve here that prevents you from both urinating and ejaculating at the same time. The Cowper gland here adds some lubricant to make everything smooth and slippery and come out easier. So the testis or testicle is the main sex organ for the male. In a primordial fetus, the testes and ovaries are one structure. Depending on your hormonal situation, the testis will either convert into a testicle and drop down into the scrotum through the inguinal canal, or it will remain up in the body and convert into an ovary. The testis has seminiferous tubules, which make the sperm. And your primary androgen is testosterone. So you make a lot of that. You also make dihydrotestosterone. Actually, testosterone converts into dihydrotestosterone, which has some slightly different effects. Testosterone has its main effects on building muscle and bone, red blood cells. Dihydrotestosterone is a lot of maturation of the external male genitals. The sperm, or spermatozoon, is a little cell. It only has half of the DNA complement because half comes from the father, half comes from the mother. So when you make a sperm, it only has one of your half of your pair of chromosomes. And so it will combine with the egg, and then the fertilized egg will have all the pairs of chromosomes that they're supposed to have. It has an acrosome on the front, which it has the ability to dissolve the egg shell, and so the DNA can be injected into the cell, into the egg. And it has a flagellar tail that whips back and forth to help it swim upstream. Seminiferous tubules, lots of tightly coiled tubes within each testicle that produce the sperm. Males make sperm throughout their whole lives. Females have all the eggs they're going to have when they're born, and they gradually decrease in number during their reproductive years. But males are constantly making new sperm, which are either used or wind up being reabsorbed. The epididymis is a structure right on the outside of the testis that stores the sperm, and the Vas Deferens or ductus deferens is the long tube that carries the sperm all the way through the seminal vesicles, the prostate gland, and into the urethra. Seminal vesicles, prostate gland we talked about. This is where you're making some extra fluid. Prostate gland does that too, and the prostate gland is famous for swelling up when you get older and making it hard to pee because the urethra goes right through the middle of it. The penis is basically two parts. The shaft, or spongiosum, which is, has sponge-like tissue inside of it that fills up with blood when you have an erection. The glans is the head of the penis. The semen has sperm and the seminal fluids and secretions from the prostate in it. Genitalia refers to all the reproductive organs, so male genitalia, female genitalia. And gonads are the testes and ovaries. So it may be, you start off with primordial gonads. The male's gonads become testes, the female's gonads become ovaries. Form the sperm, store it in the epididymis, through the Vas deferens, seminal vesicle, prostate, into the urethra, and out. You can see part of this urethra is still inside the prostate gland. That's where a swelling prostate will make it, it'll pinch it and make it hard to urinate. So, let's define our word parts, or our words based on word parts especially. Glans, balano, is the medical term. To remember it, I think it looks like a little balloon. Balano is the glans. Epididymo for epididymis. Testo, you can have testicular cancer, yes, but more often the conditions of the testes are use the term orco or orchido or orchio. I guess they thought it looked like an orchid. I don't know, but anyway, orchio, orchid, orchido or orco. Prostato for prostate. Vaso is vas deferens. If you have a vasectomy, you remove part of the vas deferens. Vesiculo, remember on this one, it's easy to kind of get these mixed up. Vesiculo, seminal vesicles. So you sometimes have inflammation of the seminal vesicles or an ectomy and take them out as well. So looking at this, seminal vesicle, vesico. Prostato, yell them out yourself. Epididymo. Remember what the bladder is? Cysto. Cysto. Vas deferens, vaso. Glans penis, balano. And testis is either testo, orchido, orchio, orco. Some reproductive terms, andro, like an androgen. Andro means male. Gyneco means female. So, you know, you can have gynecology as the study of female. Andro and androgen. Andropathy is a male disease like prostate cancer. Spermato or spermo for sperm. Ism. We have a lot of something isms, and it just means to a condition or related to that part. orgointesto. Yeah, we just said that a few times. So, putting these together, you can imagine the itises and pathies that might show up here. Male reproduction. So here we have a condition of no testis. Born without testes. It doesn't mean they're hidden. That's a different thing. Anorchism means you're born without testes. Balanitis, inflammation of the glands, the head of the penis. Balanorrhea, flow or discharge. You'll see this a few times. Benign prostatic hyperplasia, BPH. You'll see it on TV. Apparently all old guys have BPH. As a matter of fact, most of them do to some degree, and you can take drugs and shrink it somewhat. And this means an overgrowth or swelling of the prostate that is not cancerous. Remember our onychocryptosis with our ingrown fingernail or ingrown toenail? It means crypto means hidden or underneath. Cryptorchidism means the testes haven't descended. So, the testes are still up in the abdomen, or the pelvic cavity anyway, at the time of birth, and they descend right about that time into the scrotum. In some cases, they stay hidden, and they have to be either induced to descend by drugs or surgery. Epididymitis, inflammation of the epididymis. Orchiepididymitis, the testis and the epididymis. Inflammation of the testis. Inflammation of the prostate. Inflammation of the prostate and the seminal vesicles. Or no, in this case, they're talking about the prostate and the bladder, cystitis, not vesico. Prostatocystitis would be the prostate and the bladder. And remember, the bladder empties right through the prostate. They're right next to each other, prostatocystitis. Prostatolith would be a stone in the prostate. Prostatorrhea, a flow coming out of the prostate. Here we go, prostatevesiculitis, the prostate and the seminal vesicles, inflammation. BPH swells up, restricts the urethra, makes it hard to pee, makes it hard to empty your bladder completely, so you always feel like you still have to pee when you're done peeing. Hidden testis. This child was born with the testes still up in the body instead of descended through the inguinal canals. Cryptorchidism. Cryptorchidism. A variety of things not built from word parts. Erectile dysfunction, or ED. If you believe the ads on TV, every male in the United States suffers from erectile dysfunction. Not especially generous on their part, but they want us to buy their ED medicine. Hydrocele. Remember what a seal is? It's a herniation. And in this case, it's a swelling or herniation of the scrotum due to filling up with water. Phimosis. The foreskin is too tight for the glans penis to move through it. The kid will need a circumcision, or at least an operation to loosen up the foreskin so the penis can go through it. Priapism is your famous erection lasting more than 4 hours. It's actually a very serious condition. It can result in reduced blood flow to the penis because there's so much pressure that it doesn't allow decent blood flow, and it can do damage. Unfortunately for us, Viagra and the other erection producers have had the best time warning us against priapism, because a guy who can't get an erection thinks an erection lasting more than 4 hours is like heaven on earth. It's not, but the fact is they always have to, in every ad, say, if you get an erection lasting more than 4 hours, see a doctor. And of course, that's actually a good selling point for them. Prostate cancer, that makes spermatocele. This is a herniation of the spermatic tube system. Testicular cancer, testicular torsion. The testicle becomes twisted inside the scrotum, and it can block off the ability of it to empty its contents. It can also block off blood flow, and it can be very painful. Varicose eel, it's like varicose veins in the scrotum. The veins within the scrotum are varicosed or enlarged. Here's the varicose eel, enlarged, stretched out veins. Discharge from the prostate gland would be what? Prostatorrhea. Rhea is flow of anything. Some surgical terms. Belanoplasty. What are you doing? You're fixing it. And what are you fixing? The glands, the head of the penis. Epidydymectomy, removing it. Orchidectomy or orchiectomy, removal of a testicle, probably testicular cancer. Orchidopexy, orchiopexy, re-establishing position, fixing it back into place where it's supposed to be if it's hanging down too far. Otomy, making a cut in it. Orchioplasty, fixing it. Prostatectomy, removal of the prostate, usually prostate cancer. Prostatectomies they're not totally easy on the person. If you can treat it without removing it, it's better. Removing the prostate sometimes leaves the male incontinent. They can't control their urination, and impotent. Sometimes. Prostatocystotomy, making a cut into the prostate and bladder, the cyst. Prostatolithotomy, make a cut into it to take out a rock, a prostate stone. Prostatovesiculectomy, removal of both the prostate and the seminal vesicle. Vasectomy, taking out a piece of the vas deferens, removing it to sterilize the male so you can't have kids. Vesiculectomy, removing just the seminal vesicle. Suprapubic prostatectomy. There are procedures you can do going through the urethra, and the other way is to go above the pubic bone and make a pretty big hole and remove the prostate gland or do repairs or whatever. So suprapubic is going to be on top of the pubic bone as opposed to going up the urethra. Laparoscopic is also going to be suprapubic, but at least it makes a smaller hole. Vasectomy, snipping out a piece of the vas deferens and tying off both ends so sperm can't be delivered. Circumcision is removal of the prepuce or foreskin. A large number of young males have a circumcision when they're first born. Initially, to circumcise or not was a religious thing. Sometimes it is still. Most people do it. It's sort of a sanitary thing. It's easier to clean a young penis that doesn't have the foreskin over it. Hydrocelectomy, removal of the herniation. Radical prostatectomy means taking the whole thing out. Suprapubic, we saw that. Transurethral incision of the prostate gland. So that's going through the urethra and doing a roto-rooter or taking out some of it. Transurethral microwave thermotherapy goes up the urethra but uses a hot wire and burns it out, or uses microwaves to produce the heat. Transurethral resection means taking the whole thing out. So here you're reshaping it, making a bigger hole. Here you're probably making a bigger hole with heat. And here you're removing the entire prostate. Transurethral resection of the prostate. Now, usually they wouldn't try to remove the whole prostate this way. They would go in and take out some of it. A suprapubic would be a better way to get the whole thing out. Otherwise, you have to take it out little bits at a time so it can fit through the urethra. Surgical removal of the foreskin, circumcision. Some diagnostic terms. Transrectal ultrasound. So this is putting the ultrasound into the rectum and looking. I mean, you can be looking for a variety of things, but in this case with male reproduction, you're actually doing an ultrasound of the prostate and other reproductive structures through the wall of the rectum, which is right next to them. PSA, prostate-specific antigen. Your prostate gland produces a particular substance that can be measured in the blood. It's always making some, and when it's unusually irritated, it makes more. And so if you do a PSA and it's really high, you might suspect you have prostate cancer. The only problem is other inflammatory type conditions, such as prostatitis, can also cause the PSA to go up. So it gives false positives. So there's some concern that there's enough false positives that it's not a great test for men to do, because they might then undergo a lot of serious, complicated either surgeries or procedures that were unnecessary because it was a false positive. But it's still used a lot. Semen analysis. Look at it under a microscope and count the sperm. If you have less than 20 million sperm per milliliter, you're basically infertile. So you analyze to see if there's enough enough sperm in the semen. Digital rectal exam, or DRE, is the primary easy way to screen for prostate problems. The prostate is right next to the wall of the rectum. The doctor puts on the glove and puts the finger in there and pushes on the prostate. And if it's big, they can tell. If it's big and soft and smooth, it's probably BPH, benign. If it's hard or lumpy, it's likely to be prostate cancer. And so it's a good screening for both BPH and prostate cancer. Some complementary terms: andropathy, male disease. So only a male can have testicular cancer or prostate cancer or BPH. So those are andropathies. Aspermia means you don't have any, theoretically. Oligospermia means you don't have enough, scanty amounts of sperm. Spermatolysis means the sperm are breaking apart. You're making enough, perhaps, but they're breaking apart. AIDS, acquired immunodeficiency syndrome, a sexually transmitted disease, which we know quite a bit about, comes from the HIV virus, which is almost entirely passed back and forth by sexual intercourse and exchange of body fluids. You can also get it by using a needle for IV drugs or use or something by somebody who has HIV. Artificial insemination, taking sperm from a donor and injecting it into the female. A zoospermia, there's no sperm in the ejaculate, so you still have some fluid coming out, but there's no sperm in there. Chlamydia is a sexually transmitted disease. Coitus is intercourse. Condom, both male and female condoms are available for preventing sperm from being transferred into the woman's reproductive tract far enough that it could cause fertilization. Ejaculation is the process of the male expelling the semen and sperm. Genital herpes, the primary viral condition that is passed back and forth. Of course, HIV is passed back and forth too, but genital herpes is very common, passed back and forth primarily by sexual intercourse. The herpes simplex 2 virus mainly. Gonorrhea, an infection, an STD infection. And I still call them STDs because I'm old-fashioned. Most people are calling them STIs. Instead of sexually transmitted disease, it's now a sexually transmitted infection, because you can have HIV transmitted and have no disease. What you have is the virus in you, but if it's controlled, you don't actually get the disease. So sexually transmitted infection is truly more accurate. Human immunodeficiency virus is the HIV virus that can cause AIDS if it's allowed to. Human papillomavirus, HPV, is the virus that causes warts on your body. In this case, we're talking genital warts, which can be on the penis or the vagina, the labia, and is a primary cause of cervical cancer in women. Infertility means that you can't produce offspring. In a male, it's generally because he doesn't make enough sperm. The female might not be able to produce a viable egg or to get it downstream far enough for it to be fertilized. The orgasm is the process of the culmination of the sexual event, which leads in the male in ejaculation of sperm, and in the female, the opening of the cervix, the pulsating of the vaginal walls to help move the sperm into the uterus. Puberty is a time about 12 to 14, 15 years old, where you have a burst of sexual hormones and causes maturation and sexual viability. Sexually transmitted infection, STI or STD. Probably you'll still see STD written in literature more because it's up until fairly recently that was the more common term. Sterilization. For a guy, it's a vasectomy. For a woman, it's a tubal ligation. Tie your tubes so that the egg can't reach the sperm, so you can't have children. Syphilis, another bacterial infection disease, used to kill a lot of people and be terribly serious. Now it's generally treated. Trichomoniasis. Remember, tricho means hair. Tricho means hair. This is a little parasite that can be transmitted. Women are more likely to have some side effects from this and have it than men are. The signs and symptoms are relatively mild, but it's a good thing to get rid of. And the little parasite has little hairs coming out of it. So the trichomoniasis name. So here we have a more complete summary of the sexually transmitted infections: acquired immunodeficiency syndrome, AIDS, human immunodeficiency virus, HIV, syphilis, genital herpes, human papillomavirus, venereal warts, HPV, gonorrhea, chlamydia, trichomoniasis, and some cytomegalovirus infections as well. How about abbreviations? Well, we've seen a few of them. We know AIDS, benign prostatic hyperplasia, digital rectal exam, erectile dysfunction, the HIV virus, human papillomavirus, prostatic specific antigen, PSA, a radical prostatectomy, sexually transmitted disease, or STI, sexually transmitted infection, transrectal ultrasound, transurethral incision of the prostate, microwave thermotherapy, and resection of the prostate. Transurethral means it's going through the urethra. Which is an STD? Chlamydia. So here we have our write-up from a visit here. Chief complaint: left lower abdominal pain and the inability to void. In other words, urinate. Pee. 75-year-old male who presented to the department saying he was in great pain and could not urinate. He's been seen by a physician. He's normally in pretty good health. He reports urinary frequency nocturia ×2. This means at night he has to pee twice on average. Get up and pee. Hesitancy, intermittency. It takes a while to come out. It'll pee for a while and stop, and pee for a while and stop. Diminished force. Caliber means the diameter or volume. So it's dribbling out instead of squirting out. Post-void dribbling, sensation of not completely emptying. And he had a little blood, hematuria, at the end of urination. Temperature was 98.6. It doesn't sound like he has an infection. Blood pressure's a little high, as he reported. Pulse is a little high, and respirations are a little high. You know, your pulse should be somewhere around 70, and respirations are more like 12 to 14 or so. But he's in pain. He's hurting. Suprapubic mass, A three-finger rest to load the umbilicus. Dull to percussion, thump, 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 thump. It's not sounding hollow, and somewhat tender. They do a digital rectal exam, and it relieves an enlarged prostate without hard nodules. So what does that probably mean? Probably means BPH. Now, it could be a little bit inflamed, and prostatitis can cause a little bit of blood to come out sometimes. Urinary bladder distension, urinary outlet obstruction, and urinary retention, which means that you're retaining urine and not getting rid of all of it. BPH. They put a Foley catheter in so the urine can come out and it'll stop hurting so much. And then a urology consult to see if there's anything that they actually need to do to relieve the BPH condition. So here are some of the things we're going to be looking at. Anorchism, we saw that, none. Balanitis, Balanorrhea, BPH, prostatolith, that's a stone. So what does it look like? Anorchism, no testes. Now if it's cryptorchidism, then the testes are up here, they just haven't come down yet. Anorchism means you just don't have any. Balanitis, inflammation of the glands. BPH, swollen up here, so it's blocking it off. You can see how a DRE, a digital rectal exam, would work easily because you can push right on the prostate. It's right up against the wall of the rectum. BPH again. It's a big deal. Most older men have some swelling of the prostate and some urinary difficulty. Cryptorchidism can be way up here closer to where the ovaries are, where they started off, or it can be partway down. The inguinal canal runs along about here. This is the tube that allows the testes to come down into the scrotum, and it remains a weak spot on the male abdomen for their lifetime. It's a very common place to have hernias, called inguinal hernias. Unilateral cryptorchidism. One of them stayed up there. It's got to be brought down. Primary hypogonadism usually is if you have either you're not making enough testosterone or dihydrotestosterone, you're not able to produce enough of your follicle-stimulating hormones from the pituitary, LH and FSH, or you have an inability to respond because your receptors are insensitive, perhaps, to some of these hormones. You can wind up with a lack of development. And because your body requires testosterone to convert into a complete male phenotype, your outlook, someone with this hypogonadism is likely to have a little bit more of a female shape and maybe some breast development. Epididymitis, inflammation of the epididymis on the outside of the testis. Here we have our erectile dysfunction, hydrocele, priapism, varicose eel, prostate cancer. So a hydrocele is this essentially herniation of the whole scrotum due to filling up with excess fluid. And the removal of the fluid returns it to normal size. Hydrocelectomy. Hydrocele. Enlarged, swollen, and painful. Phimosis, the foreskin or prepuce is so tight that the head can't come through, erection being virtually impossible under that condition. Erectile dysfunction inability to fill the cavernosum, the spongiosum here with blood and result in the erection. Things like Viagra produce nitric oxide, which dilates blood vessels and produces more blood flow. Here we have where priapism came from. Only male humans would think that it would be godlike to have a penis that had to be held up by a crane. But we actually had a god, Priapus, and his name was put on to the erection that lasts more than 4 hours. Priapism. Seems that males at all times in history were kind of interested in this phenomenon. You can actually get an implant that you can pump up and then release when you want to have an erection or not. Testicular torsion, twisting of the testis, maybe twisting tight the spermatic cord and blood vessels leading down to the testis. Varicose Eel, we saw this, the kind of varicose veins inside causing a herniation inside the scrotum. Removal of a varicose eel. Circumcision, taking the prepuce off. Like I said, it's done in probably the majority of babies shortly after they're born, before they can completely figure out what pain is. Everything is so startling and everything that it's a lot of things like that are easier then than they are any time later. Circumcision. TERP, we saw this one. Transurethral. Microwave therapy, transurethral. Heat waves. Heat wave. Needle ablation. So here you're actually kind of stabbing through it and probably vacuuming some of the tissue out. Digital rectal exam, DRE. Some not built from word parts things that we've seen. I mean, here's chlamydia. Causes really serious lesions. It's pretty easily treatable as long as the very first signs and symptoms are treated. Genital herpes, like a cold sore on either the penis or in the vagina. Herpes simplex virus 2. Simplex 1 is mostly cold sores on the face. 2 is mostly genital herpes. Genital herpes again. Gonorrhea. Again, if left untreated, these they can cause sterilization. They can cause, some of them could be fatal because of infections they can produce. This one obviously was let go too long before any treatment was attempted. Causes problems throughout the GI tract too, especially in the back of the mouth and the throat. And one real serious side effect is the effect that it can have on a newborn who's moving through a vagina that has herpes, HPV, HIV, anything that during the childbirth procedure the child can pick up things like gonorrhea. Male condom. And a female condom. Inserted internally instead of on the outside, obviously. If we can get guys to wear the male condoms, a female wouldn't have to put up with this. Cytomegalovirus in a newborn. Once again, almost surely got it from the mom. HPV Genital Warts. It's very unusual for genital warts to cause cancer in males, but it causes a lot of cancer in females. Female genital warts. Here's our trichomoniasis. Look at the little hairs. You can see why it got tricho added onto its name. Syphilis. Ulcerations on the penis. Inflammation of the lymph nodes. And if it's let go long enough, in the days before they had antibiotics and things they could treat it with, it would cause, complete destruction of genitalia. It would cause holes in the skull to develop, people to go crazy and then die from it. Secondary syphilis on this person's back. Male reproduction. Hello. There we go.